So who are our survivors today? Largest constituent population are our breast cancer survivors, a very vocal group, followed by prostate and colorectal cancer survivors. I'll just note, and here I can't actually point here because these are behind me, but I will just point out that our lung cancer survivors, even though a very common disease, are not among our largest population of survivors, reminding us that we certainly have work to do in these domains. When we look at length of survival, as we see now, about 60% of individuals are more than 5 years out from diagnosis, and an impressive 14% of that population was diagnosed 20 or more years ago. And this is a pattern we're going to see more and more of, that these bars are going to be shifting more to the, let's see, your left. Over time, we're going to see people living longer with these histories, and the consequence of that is that we're going to see them have other cancers. And again, I'll come back to that theme in a little bit. As you march across time here, you will see those bars, the blue bars becoming lower than the white bars, the males not outliving or not living as long as females. And that's really driven by a couple of factors. One is women have cancers that are more readily detected. Breast cancer is a good example. Plus, you can have that disease in very young women, from teenagers up to nonagenarians, centenarians, not like colorectal lung cancer, which you see in older populations. So there is that length of time available to survive longer. And also women have, of course, lower all-cause mortality. We're just better designed, guys. This slide is really a graphic reminder that the most important risk factor for developing cancer, of course, is age. And so as we have an aging population, those of us who are in the boomer generation, born between 1946 and 1964, we're coming at you fast in the pipeline, you know, the pig and the python kind of phenomenon. We're going to be hitting the healthcare system very soon. And loading up your clinics, and you're going to be following us over time. So we're actually very eager for you to pick up all of these new quality practices and being able to deliver and work with us to provide care, because we're also a pretty well-trained group in terms of political activation. We're going to be on you about being involved in our care and coordinating that care with you, and sometimes telling you what we want you to do, whether you like that or not, or whether that's good for us or not. But this is very important to keep in mind, because these figures aren't going away. When I show you this graphic, though, I will tell you, when you look at the research, the published research that's out there, we have quite a bit of research, obviously, on our pediatric survivors. These have been our vanguard in the survivorship movement, if you like. This is where we had the first really exciting cures, ALL, childhood brain tumors. Children miraculously turned around the course of their lives with these newer treatments. And the pediatric community got it right away that cure was not enough. They had to be focused on long-term outcomes. We've been a little slower in the uptake on the adult side. And the consequence is most of the research that we have is really in adults, among the 40 up to 59-year-olds. We have very limited data on individuals who are cancer survivors age 65 and older, and that's troubling when you look at the fact that they represent the vast majority of our cancer survivors. This is a dearth of information we have, and these are individuals who are treated in your communities. That's where the majority of these individuals are, is in community settings. The younger individuals often get themselves to big comprehensive centers. People who are older often stay in their communities for care, and so we need more information about the outcomes of those individuals. I dropped this slide in because it's a graphic reminder that although we've made all of these advances and we're delivering these across the United States, we still have health disparities that we need to address. Not everybody is receiving equal care, and as a consequence, their outcomes are not equivalent. We'd like to see these bars all on top of each other up at that higher end. So when we look back at what's been occurring in the last several years, we know that about 66% of adults diagnosed today will be alive from 5 years from now, and among children, those figures are much better. We will probably make the 2010 Healthy People goal of 70% 5-year survival for all those diagnosed with cancer, so that's good news. If you're looking for that outcome metric, that's one of them. We do know, however, that while we cure for an increasing number, if we can agree on a definition of cure, but for many individuals, cancer is going to become a chronic condition. And that requires a different philosophy about how we're delivering care and conceptualizing and communicate about this to our growing population of survivors. We also know, as I mentioned earlier, that cancer is a family disease. It's not the individual who's treated. These Cancer patients come to the clinic with family or friends. They are part of the care team. They need to be incorporated in this, HIPAA notwithstanding. We need to work with our families and to provide them support so that they can be effective caregivers, feel good about the care they're giving, and actually relieve the burden on survivors themselves. And that bottom line in here is that 80% figure that everybody throws out, although I've never really seen how they got that calculated. I think it's correct. I think they sort of took the big comp centers and how many patients they saw and just subtracted it from all the cases across the country and then come up with some estimation of how many individuals are treated in the community. But what we do know is most people are treated near their homes. They don't go huge distances if they can help it to get their care. And so delivering state-of-the-art care in those settings is critical.